Hello everyone, hope you are doing good. So today I want to talk about cubitus valgus. Cubitus valgus is basically increased angle of forearm from the arm. So to understand that, first we need to know what is carrying angle. Carrying angle is the angle formed by the forearm with the arm. Now why this carrying angle is there in human body? It is because when we are walking we need to clear our arms because our waist is narrower than our pelvis. So if the arm being straight, it might hit our pelvis a lot. So that's why this carrying angle has to be there, which is more in women than in men because the pelvis of women is broader than men. This is the normal carrying angle, which is between 5 to 15 degree. This is increased called cubitus valgus and this is decreased called cubitus varus. So how it increases or why it decreases? It can either decrease or it can either decrease. What happens if it increases or decreases is, one of the things which happens is that you won't get admission into army. Why? Because it might hamper your performance, the physical performance in the army. Other than that, if depending on what is the reason behind it, it can be hampering. It might lead to pain later. One of the things which commonly happens if it increases more is that there is a nerve which is called ulnar nerve, which supplies this little finger and half this finger, that gets pressed because it passes just below this bone from here. You can even feel that nerve here. So that gets compressed and it might lead to pain or maybe this sensations in your hand, in your arm. So that is another thing which can happen, and why the increase in the angle happens. So it can be either congenital or it can be acquired, it can be post-fracture. So there is a muscle, the biceps muscle, which is attached, goes and attached on this side of the bone. That is, this is the radius bone. So on the head of this bone it attaches. So if you do push up a lot and work on your biceps basically more, this muscle will shorten and it will pull the arm towards this side. Though if in your push-ups you are taking care that you are working on your triceps, your biceps, both there are long heads, short heads of these muscles. So if you are working properly, then this will not happen. But if the training is not proper, if your trainer is not proper, then it can happen that this angle will increase because the muscle is going to pull on it. There are other reasons also along with it which might lead to this problem. So what are the reasons for it to happen? So one of the reasons can be congenital in some of the syndromes, for example, Noonan syndrome, Turner syndrome. The kids with those syndromes have increased carrying angle. Then even with the kids with cerebral palsy, because they use a lot of upper limb movement, if lower limb is not working properly, if the lower legs are not working properly, then also this angle might increase in those kids. And actually for those kids it is more important because this, when the lower legs are not functioning very well, also in the cases where there is paralysis in the lower limbs, then they use actually upper limb as lower limb. In those cases also it might increase the pain or it might increase the angle and the other things. Then fracture, that is supracondylar fracture, which is very common in kids, can also increase. It is somewhere here. So that fracture can also lead to this issue, increase in the carrying angle. If the alignment which happens post the joining of the bone is not proper, then it can happen. Then it can be bilateral, it can be on both the sides, like right and left arm also. So can we work on it or can we not? Yes, we can work on it. Yes, it is very difficult to work post ossification, which is like 16 to 18 years, in which the bones ossify and they join. After that, surgical approach is something which might help. Still, that doesn't mean we cannot try. We can still try to work on it, especially if the angle is not much deviated towards away from the normal. But if spotted early and if worked upon early, it is always better. So you can work on it. You can, to work on it, you have to first assess. So you might need to reach out to a therapist who will assess the child and understand the reason behind why the angle is increasing or why the angle is more. And then they would work on those reasons and then come up with exercises or come up with other solutions like taping or maybe pro wraps. using the adjuncts and guiding you with those things to work on this problem, that is increased carrying angle. And for the kids who are looking forward to go into defense forces, the parents should be aware, the kids should be aware that this is one thing which might stop the knock knees, the cubitus valgus, cubitus varus. These are the things which might be might hamper their admission into the army, because they'll not get selected because of the physical issues. So yes, you can work on it, and this is what I wanted to give information about cubitus valgus. If you have any queries, please reach out to me. Thank you. Have a good day.